This presentation is on lymphedema for exercise science special populations. Before delving into lymphedema, it's important to understand how the lymphatic system functions when it's healthy. The lymphatic system operates in tandem with both the cardiovascular and the immune systems. It helps to maintain fluid balance by returning fluid from the tissues to the vascular system. Lymphatic organs and structures, such as the spleen, thymus, and lymph nodes, also assist the immune system by producing, storing, and delivering various immune cells. During normal circulation, a portion of the body's blood plasma seeps through the capillaries and into surrounding tissues. This fluid is known as interstitial or extracellular fluid. Now, about 90% of interstitial fluid re-enters circulation through venous capillaries. The residual fluid is primarily composed of proteins that are too sizable to pass through the venous capillary walls. This fluid can also contain other substances, such as water, minerals, fats, nutrients, damaged cells, and even pathogens. This fluid is routed into lymphatic capillaries, and from that point on, it's known as lymph or lymphatic fluid. Once lymphatic fluid enters the lymphatic capillaries, it's transported away from the tissues through lymphatic vessels. These vessels pass through a network of glands, known as lymph nodes, which filter out harmful substances. These nodes also act as a manufacturing site and repository for various immune system cells, and that includes lymphocytes, which are a type of white blood cell. Lymphocytes circulate within the lymphatic fluid, and they destroy viruses, bacteria, toxins, and cancer cells. Through a series of one-way valves, lymphatic vessels deposit lymphatic fluid into the right and left lymphatic ducts. These ducts empty into the subclavian vein, and that returns the lymphatic fluid to the bloodstream. Lymphedema occurs when lymph fluid accumulates in the tissues due to malformation, blockage, or damage to the lymphatic system. Lymphedema can be diagnosed with tests that use radiation or contrast medium to assess the patient for lymphatic obstruction. Sometimes other tests are used, including CT scans, MRI. If the lymphedema occurs in a limb, healthcare providers can provide a diagnosis through a physical exam. They'll take circumferential measurements, and generally, if the affected limb is at least 2 centimeters larger than the healthy limb, the client is diagnosed with lymphedema. Now, unfortunately, there's no cure for lymphedema. Treatment is focused solely on decreasing swelling and alleviating other associated symptoms. There are 2 categories of lymphedema. Primary lymphedema is the result of genetic abnormalities. It inhibits normal lymphatic development. Primary lymphedema is rare in the United States. It affects only 1 in every 100,000 Americans. Signs and symptoms can be present from birth, or they can actually develop later in life. Secondary lymphedema is the most common form of lymphedema in the United States, and that affects 1 in 1,000 Americans. Secondary lymphedema in the United States is usually associated with cancer. Tumors can obstruct the lymphatic system. Surgery can result in the removal of lymph nodes, and cancer treatments like chemotherapy and radiation therapy, they can damage the surrounding lymphatic tissues. Now, women who have undergone treatment for breast cancer are most at risk. Lymphedema is seen in 10 to 40% of breast cancer patients who've had an axillary lymph node removed and participated in radiation therapy, because obviously that's going to cause significant destruction to lymphatic tissues. In developing countries, it's interesting to note secondary lymphedema can also result from parasitic infections, where the parasites invade and then obstruct the lymph nodes. Lymphedema occurs when interstitial fluid production surpasses the rate of lymphatic transport. So that results in the accumulation of interstitial fluid in the bodily tissues. Because the lymphatic system transports fluid away from the tissues, signs and symptoms of lymphedema are typically experienced below the point of blockage or dysfunction. And in that affected area, clients can experience edema, numbness or paresthesia, sensations of discomfort, heaviness, tightness, reduced range of motion, fibrosis, which is toughening of the skin, recurrent infections, and diminished healing. Here we see upper limb lymphedema, which is most commonly associated with breast cancer. Now, stage 1 occurs when the client experiences clinical lymphatic dysfunction, but they're not actually experiencing any sign and symptoms outside of those measurements. Stage 2 is where the client has noticeable swelling, although at this point it is still relieved by elevation of the affected limb, and if you were to press on the affected limb, you would still be able to create an indentation. By stage 3, elevation no longer helps with the symptoms in the affected limb, and you can no longer create an indentation by pressing on it. At this point, the client can start to suffer from skin fibrosis. Stage 4 is where the client is going to demonstrate serious deformity. They can have scarring, growths, and thickening of the skin, and all of those symptoms can be quite severe. Lymphedema generally isn't treated with medication. It's important to speak with the client and confirm whether or not their healthcare provider has pursued medication of any kind, but it's not the usual course of treatment to use medications. Sometimes you'll see medications with associated problems, such as those recurrent infections or skin conditions. Usually those medications are going to be topical treatments or antibiotics. Unfortunately, there's not a lot of research on exercise physiology and lymphedema. There really isn't sufficient research to clarify the effects. There are no apparent findings that lymphedema causes changes to metrics such as exercise heart rate, blood pressure, or metabolic function. However, it'll affect exercise function in other ways. Due to swelling, lymphedema can decrease the range of motion in an affected limb, and that'll diminish flexibility. A discomfort and loss of sensation can also create balance and agility issues in patients who have lower extremity lymphedema. So in 2019, the ACSM organized a forum with a series of international cancer experts, and that included representatives from the American Cancer Society, the National Cancer Institute, and so forth. And together they developed scientifically supported exercise recommendations for cancer prevention and treatment. The roundtable concluded that there's not enough data to make a finding on the efficacy of aerobic exercise in improving or preventing lymphedema. However, there was a consensus that it's safe for patients with lymphedema, and that aerobic exercise is unlikely to exacerbate swelling or other symptoms. And here you can see an excerpt from that research showing that there is strong evidence showing that it's not going to exacerbate upper extremity lymphedema. Information on lower extremity lymphedema is a little more ambiguous. Regarding resistance training, the forum supported it, specifically supervised resistance training 2 to 3 times a week. Exercises should focus on large muscle groups, and the progression is really important. They actually had a policy of start low, progress slow. And here you can see some of the data from one of the studies that they cited. So here RET is the resistance training, and you can see the baseline. And then post-test, this is the arm difference. So again, that's going to be that circumferential measurement to see whether the affected arm is swelling a lot more. And the findings don't support that. So the evidence indicates that resistance training won't exacerbate the symptoms of lymphedema in affected limbs in the upper extremity. Here you can see an infographic from that round table. So here is lymphedema, and you can see that resistance exercise was found to improve symptoms. Unfortunately, those results weren't found in aerobic exercise or in a combination of aerobic exercise and resistance exercise. However, because they did find that aerobic exercise is safe for lymphedema patients, it's not going to exacerbate their symptoms, you do want them to participate in aerobic exercise so that they can achieve those overall health benefits that are so important and that you derive from aerobic exercise. Unfortunately, it just won't improve their lymphedema symptoms. So here's our case study. We have a 33-year-old female, non-smoker, no significant family history, no prescribed medications, fairly normal up to this point. What makes her unique in this population is that she has stage 2 unilateral left side upper body lymphedema, which means she would have a lymphedema that's demonstrating signs and symptoms in her left arm. Stage 2, if you'll recall, that's alleviated with elevation. It has discernible swelling, but it's not severe deformity yet. Actually, when you press on it, you can still create that indentation. She wants to begin an exercise program to improve the lymphedema and obtain overall health benefits, and she's been cleared by a physician. Now, you can see here that her breast cancer interventions were some time ago. She underwent a unilateral left side mastectomy with same side axillary lymphodectomy and accompanying radiation treatment, and that was a year ago. So that means they did remove her left breast. They also removed the associated lymph node, which would be under the left arm, and she received radiation treatment. And she's had time to recover from the surgery since then. Now she's actually in remission, has been in remission for 6 months, and she's no longer receiving radiation therapy. Unfortunately, despite those positive results, she did develop lymphedema 2 months ago after noticing swelling in her left arm. She has some tightness, but she's not experienced pins and needles, numbness, no impaired healing, no signs of infection. And she is again still experiencing improvement with elevation. Another thing that we see here is physician-ordered compression garments. Now, these are outside our scope of practice to recommend to people, but when the physician orders them, they can be very beneficial, and it's especially important to make sure that they're utilized with exercise, especially if you're going to be directly exercising the affected limb. So the client walks her dog about 20 minutes twice a day, but she doesn't engage in any other physical activity, so fairly sedentary. And she's concerned about this. She's worried that too much activity will make her sick, and despite reassurances from her physician, she's nervous, which is normal. You know, she's been through a serious illness. She's been inactive for a long time, so she's just a little wary. So we just have to make sure that we're supportive of that while we get her feet wet. Here we can see her resting values. They're all within normal parameters. In spite of the previous cancer diagnosis, she's actually in rather good health. And here we derive predicted values that we can use later when we're determining intensity for a program. Body composition is excellent, and even her aerobic fitness using this fitness test is good. So she really is in fairly good condition. And we see again deriving metrics for later on that we'll use when determining level of intensity that's appropriate for this client. And still good. You know, her strength is high in her right hand. You can see a decrease in the left, which is the affected arm. But again, overall, her strength is good. And here you can see that her flexibility is normal at all of the measured joints, so she hasn't had any kind of a decrease in range and motion due to her lymphedema. So we can start with the exercise prescription, and what's important about her exercise prescription is that it's a fusion of the recommendations for lymphedema patients and cancer patients according to the ACSM. So always we have a warm-up starting at a lower intensity. We'll see in a moment that this is the type of activity is going to be treadmill walking, so we want the warm-up and cool-down to be consistent and just the usual time frame. So warm-up and cool-down, lower intensity, same type. And for aerobic, we're going to start her walking on the treadmill, nothing too ambitious since she's nervous, and we'll just slowly increase the duration, keep it at a moderate intensity, but increase duration as we progress so that we can build toward the recommended time frame for those health benefits. So here's the resistance training to improve her lymphedema. Again, begin low, progress slow. So we're going to start at a 50%, which is a little low for resistance training, moving through all those major muscle groups and using the exercise machines while avoiding prolonged sitting. And finally, that flexibility will incorporate just through static stretching after the cool down. The last note is we want to be careful not to allow her to injure herself because of the decreased healing. Monitor for changes in the affected area. Stop if it becomes too fatigued, and not let that blood or fluid pool for too long by letting her swing or hang down. That concludes our presentation.